One of the core issues in this election is healthcare, and there's a good reason for that. Despite the ACA's passage a decade or more ago, we're still very much in a crisis. According to some calculations, 37 million Americans still don't have health insurance. 41 million more have inadequate access to care. And so everybody is looking for a way to improve this situation. And so I noticed this study called Improving the Prognosis of Healthcare in the USA, written by a number of doctors, published in the Lancet. And so I was very interested. They did this big meta-analysis of a whole bunch of different proposals. So what did all these doctors find out? Well, they say that taking into account both the costs of coverage expansion and the savings that would be achieved through the Medicare for All Act, we calculate that a single-payer universal healthcare system is likely to lead to a 13% savings in national healthcare expenditure, equivalent to more than US $450 billion annually. That's compared to the current system. It's going to save us $450 billion every year, taking into account those things. And it turns out that's not the only benefit that they found. According to the study, by replacing premiums, deductibles, co-payments, and out-of-pocket costs with a progressive tax system, Medicare for All will save the average family thousands of dollars each year and will provide lower-income households the greatest relief. And so I know what like Chuck Todd's gonna respond, yeah, but what about the taxes? That's gonna cost. No, this is factoring all that in. This is the cost of healthcare versus the current system, including the tax changes that would be necessary to implement it. We would be saving $450 billion total. Families would be saving a ton, and those who need the money the most will be saving even more. But the monetary savings are not the most important savings that would come from this, according to this study. They estimate that ensuring healthcare access for all Americans would save more than 68,000 lives a year, and 1.73 million life years every year compared with the status quo. And that's always the thing that's so amazing to me when we talk about the current system and proposals. And it's like we get so focused on the cost, which I think is a huge dodge since we know that it's actually cheaper. And we forget that 68,000 people hypothetically from not having health insurance or not having enough health insurance, the numbers are different depending on who you talk to, but tens of thousands of people at the very least are dying every single year. And if they were dying from anything else, it would be a national emergency. It would be the national emergency. I mean, if it's like from opioids and stuff like that, we've totally gotten used to that. We're totally okay with 50,000 people dying every year from car accidents. There's certain sorts of things we're okay with. But God, 68,000 lives hypothetically could be saved. And that's the most important takeaway, but there's others too. I mean, doctors and hospitals would see large savings in cost and time from streamlining our bloated and inefficient administrative and billing system, allowing doctors to spend more time with patients, according to the study. So it's good for individuals, especially those who will live rather than die under the new system. It'll save the government a ton of money, it'll save families a ton of money, and it's actually better for doctors, allows them to focus less time on filling out paperwork and more time actually spent doing healthcare doctory type stuff, which seems good for them. And look, this new Lancet study is huge, obviously, but it's not an outlier. Last month, another medical journal found that 19 out of 22 studies done over the past 3 decades concluded that moving to a Medicare for All single-payer healthcare system would cost less than our current healthcare system in the first year, and all of the studies showed that it would cost less within a decade of implementation. I'd love a question in a debate to sort of mention that. Seems sort of significant. Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.